Hello, welcome back. The topic today is why people after gallbladder removal, some people come and say, I have still have the abdomen pain. See, the gallbladder removal surgery is very essential, is needed. Why? Because there is some disease or some problem in the gallbladder. Either it's a gallstone, a polyp, or some tumor, or some pus collection. Some disease is compelling us to remove the gallbladder. In a day, the world, almost 80,000 to 1 lakh gallbladder surgeries are being done every day. Such a common disease. But most of the people after surgery, they come and say, still have pain in the abdomen. Or even after 2 years, they come and say, I still have the abdomen pain. You know, or my neighbor told me, don't remove the gallbladder because you will have the same pain. You know, no. So we will see why. Number one, we can differ. See, we are removing the gallbladder for a reason. Otherwise, what will happen? The gallbladder disease, the stone, polyp, tumor, they'll give complications like infection or abscess or even gallstone dyspepsia, pain, aversion to fatty food. Sometimes jaundice will come, pancreatitis can come, and it can endanger the life of the patient. So that is the reason we have removed the gallbladder, and why some people have pain even after gallbladder removal. First, we can divide it into 50-50. First 50, we can call this as a biliary. Biliary means something to do with your liver, gallbladder, or the bile tract, or non-biliary. So first we'll see 50-50%. First we'll click on the non-biliary causes. Most of the time, these gallbladder surgery or gallbladder disease are around 40 years, 50 years people. So by that age, normally people already have some ulcer, GERD, gastritis, something to do with their GI problem would be there. So gallbladder problem was there, so that was removed, but there are already existing natural problem is there, so they may get pain often. And very important, otherwise they most around 40-50 years, they may be taking some medications regularly. Like simple example is thyroid medicines. Suppose they are taking more than 100 mics of thyroid medicine every day, that can cause gastritis, causing pain. But people think it's after the surgery the pain still there. No, it's because of the medicine. Or they may be taking aspirin for the cardiac problem. Aspirin is a wonderful lifesaver, but it can irritate the stomach and cause pain. Same way, metformin, wonderful medicine, but it can cause gastritis. So these are all non-biliary other reasons for the pain. Even some painkillers, antibiotics, that can cause pain. And other reasons, maybe sometimes some H. pylori infection or IBS, even diverticulum. Suppose they have a diverticulum in the large intestines, so they can cause diverticulitis and pain. So that could be the gallbladder problem is over, but the pain is different. So they can think it's all because of the gallbladder problem, or removal of the gallbladder aggravated the problem. No, it's an entirely different problem. Okay, this is one part. And they may sometimes even have a regular ulcer. After the surgery they are fine, but they would develop ulcer that can cause pain. So these are non-biliary reasons. What are the biliary reasons? Biliary reasons, as I told you, after the gallbladder removal, there is no gallbladder. The function of the gallbladder is to pump the bile. Now there is no pumping, so there is a good continuous flow of bile into the small intestine and stomach. So these bile can cause gastritis. So they can feel pain, gastritis pain can happen. This is very normal. Number two, suppose in the biliary tree, still there are small microliths, we call that small stones, they can get large and causing pain or infection, or even cholangitis, the bile tract sometimes gets infected, or air like pneumobilia, so air traps in and causes this kind of pain can happen. And the sphincter of Oddi, see the bile tract and pancreatic duct, the bile duct, they join together and commonly they enter into the small intestine. This common channel is guarded by a valve that's called sphincter of Oddi. The sphincter of Oddi, if it's affected or some problem, they can get this kind of pain. So, or sometimes they have a pancreatitis for some other reason, or they have some other problem, nothing to do with their biliary tract. Suppose they have appendicitis, or when sometimes they have an umbilical hernia, or even they may have a ovary uterus problem that can mimic as a gallbladder removal pain. So definitely once if you have these problems, you go to back to the surgeon. They will examine you. They will ask you questions. They will rule out each one by one, like any remaining stones or any other jaundice infection. They will do a CT scan, ultrasound scan, or even an endoscopy. Once they rule out, they may give PPI or antacids to elevate the pain. And the patient's part is very, very, very important. The patient has to change their lifestyle. What is that? First is, instead of three major meals, they have to eat 6 meals. And anything and everything should be steam cooked food. No oil, no ghee, all the steam cooked food is very good. And increase your fiber content. Avoid fatty meal. Avoid overeating. And these are the main lifestyle patient has to change. And once the doctor examines, they can prescribe certain medicines. Definitely this will help you. And there is one more thing is called post-cholecystectomy syndrome. What is that? 10% of the people can experience this even after gallbladder surgery removal. They feel the same pain, gastritis, loose motion, all these things. This is the exact mechanism for this nobody knows, but with the proper investigations and proper advice and lifestyle and dietary changes, this can be kept under control. So gallbladder removal surgery is a life-saving surgery. The surgery is being done to prevent the complications like jaundice, pancreatitis, infection, sepsis. So definitely don't worry about going for a gallbladder surgery. Consult your doctor even before that. Thank you.